recent New York Times report said that public health experts and scientists believe that the herd immunity threshold is not obtainable in the foreseeable future and perhaps not ever. So we hope we can address that with these mobile units. I do agree with that in terms of herd immunity and whether we can get there. The optimist in me wants to believe that everyone who can get vaccine will get the vaccine, but I don't think it's going to happen at this stage. I would hope that if people won't get vaccinated for themselves or for their families, they'll do it to help our collective communities get back to normal. I think COVID is going to be in the community for the foreseeable future, so it's really important to protect yourself and get vaccinated. We know in North Carolina, when 2/3 of the eligible population has had at least one dose and the positivity rates remain low, the governor would like to lift mandatory social distancing and capacity and mass gathering restrictions by June the 1st. I think indoor masking will be the last precaution to be lifted and probably will be with us for some time after that. The realist in me understands the trends in data. There's traffic. Even when they're all open, even though all our centers are open to walk-ins, we do have reduced traffic. So we do have concerns about getting even closer to that herd immunity threshold. I think as time has gone on, public health experts have looked at the data, looked at the vaccine hesitancy in communities and said, hey, are we going to get to that herd immunity number? The herd immunity number is not exactly known. It was thought to be 75 or 80%. Is it possible to get there? And then they compare that to the data that shows, 22% of the population or something says, I'm never going to get the vaccine. So, and a certain number says, I still want to wait. So even if you got everybody who was in that group that said they just wanted to wait, you're still left with, a pretty large percentage of the population that says, I'm never getting the vaccine. So you start to do the math and you realize, we may not get to that herd immunity number. And that's unfortunate. We want to get there, but it just means we have to think through what does that mean for our communities going forward. And what it probably means is COVID's going to be around, and it's maybe seasonal, may require booster shots every year, and we'll deal with it like we deal with other respiratory diseases that circulate in our communities. The chance to really get enough people vaccinated to eliminate it is become smaller and smaller and smaller. And so we will deal with it as we deal with other respiratory illnesses in communities. What's heartbreaking to me is that we will still see tragedies around COVID, even if the amount of COVID in the community is much lower, and we're getting closer to normal and physicians are dealing with it, but we have enough hospital space to do all that. There still will be situations where individuals will get COVID, they will die of COVID or be hospitalized from COVID, who were not vaccinated and could have been protected. And that's what's heartbreaking when those opportunities were there and people didn't take them. So that's the hard part, but we'll continue to move forward and try to encourage everybody to get vaccinated.